Dr. Kumar.
Good morning, everybody. My name is Ajay Kumar, Chief Clinical Officer for Hartford Healthcare. We're going to begin our conversation with some of the details about how many patients we're caring in Hartford Healthcare. Then we'll talk about how all the things we're doing to keep our environment safe and making sure it's a safe place for the community. And after that, Dr. Kiely, who's my colleague, who's going to join and talk about Colleague Support Center. One of the big focus Hartford Healthcare have had from the beginning is how do we support our colleagues. So let's start with some of the numbers. At this time, Hartford Healthcare is caring for 307 patients who are positive for COVID across the Hartford Healthcare acute care facilities. As you know, these numbers are declining in at least in Hartford Healthcare, which is a good sign. Our Bacchus Hospital has 8 COVID patients. Charlotte Hungerford has 16 patients. Hartford Hospital is caring for 138 patients. Midstate Medical Center has 19. St. Vincent Medical Center has 80 patients, 80. Hospital Center Connecticut 43, and Wyndham Hospital has 3 patients. That's 307 patients across the acute facility. Our community network has 178 patients. These are the patients in SNF and community network, home care. And behavioral health network has 2 patients at this time. So as we look into these hospitalization, which is a good sign that some of the work we've done with social distancing and all the efforts we've been putting together has allowed the hospitals to not get overwhelmed. As you see, we actually did hit a peak, and after that it seems like a plateau. It's a gradual decline, not a precipitous decline, but it's a gradual decline. We're going to continue to see some ups and downs in this part here because let's face it, our social distancing as it is right now, it still has a fair amount of movement happening across the state of Connecticut. We're still seeing people getting into the parks and trying to get back to and resume the normal life. This is going to have some impact. The significant challenge we've had in Connecticut is the assisted living and nursing home population being adversely affected, and that creates some hospitalizations, fluctuations at some point. But all in all, if the healthcare systems across the state of Connecticut are not overwhelmed, that allows us to be able to respond to the need of the community. When we talk about the need of the community, one of the things I just want to highlight, the things we are doing at this time to make sure our system is safe, is ready, and here for all the members across the Connecticut. We still have other chronic disease, other suffering people are putting off because of the COVID crisis. We want to assure the community we're ready to help you and support you. We've done a number of things. Let me go through some of those things. We are right now testing every single patient who comes to the ED who's going to get admitted. So we want to make sure that everybody's tested. Visitor policy remains in place. We're screening everybody who comes in, temperature and symptom screen, including our colleagues. We want to make sure our colleagues are not also having symptoms when they come to the hospital. Obviously, anybody who's a symptom or have any concerns are asked to be on the quarantine. We obviously have been paying a lot of attention to the cleanliness, without a doubt. This has been a core work we continue to do in Hartford Healthcare, but especially in the COVID environment. When the patient has been managed in the COVID room, we're following all the CDC guidelines, sometimes getting ahead of that to make sure the room is appropriately aerated. There's a right deep cleaning happens on every single surface of that. So those works have been happening. We are obviously putting together a large number of individuals who are going to be doing contact tracing in case we find a episode of outbreak or some sort of an infection. Infection prevention team can react very quickly, 24/7, 365 days a week, almost like a SWAT team approach on all parts of the organization. We're obviously looking into how we continue to expand our virtual health growth, and we're going to have a discussion later on this week to talk about the virtual health. We've exceeded 70,000 number of visits across the state of Connecticut, and we want to make sure we reach out to the community, be there for them, and support them as needed. We continue to create different type of processes across the system. We've got champions in almost all the business units or the clinical units or the areas where the clinical care is provided, where the infection champions have been trained and educated to make sure that locally we're managing the process very well. So safety is going to be the huge on our mind as we come to this, what I call as a recovery phase or the next phase of the COVID fight. We're going to continue to make sure we pay attention to that and to make provide the confidence in the society that we are here in the most safest way possible. We talked about ED. Any patient who comes who has a COVID-like symptoms, we triage them differently to make sure that they're appropriately managed in the COVID area so that other individuals who are coming in with non-COVID related illness don't get transmission because of that. So a lot of work going on, and I'm proud of that. As we began our journey of the response with the COVID, Hartford Healthcare had began the preparation in late January, and right now we've already almost in the completion of preparation to make sure that we are safe for everybody who comes in. So I want to reassure the community at this time. The discussion has been about essential surgeries. How are we doing it? That look, we've never stopped actually working. Hospitals still are providing the care to those who need it. All the urgent and emergent care has been in place, but we're obviously looking into the individuals who've been putting off their procedures for a variety of reasons, who are suffering at this time, have some unable to live their normal life, to try to get them back to the place of care. So we're going to continue to work with the community to make sure that that becomes a place of discussion. Today is the beginning of the Nurses Week. We are so proud to have wonderful nurses across the Hartford Healthcare, the amazing work they do, and a lot of heroic stories you've already heard on that part. We normally have a very different way of celebrating that, different type of gatherings and meetings and other things in all shifts. We're going to maintain the social distancing. We're going to safety is going to remain a core principle while we get through the celebration, recognize the nurses across the state within the Hartford Healthcare. With that, I know I covered a fair amount of points. I'll come back with some questions and answer. I'd like to introduce my colleague, Dr. Sharon Kiely, who is the Chief Wellness Officer for Hartford Healthcare. Dr. Kiely.
Thank you, Dr. Kumar. Good morning, everybody. I just wanted to introduce you to our Colleague Support Center, which got started at Hartford Healthcare on the 15th of April. And it was started in response to what we understood were the likely needs of our workforce and the likely worries of our workforce. We knew we had a lot of supports in place, but it wasn't necessarily easy to find on our website, largely because people just didn't have the time. We recognized at that point in the surge that it was really difficult for someone even to take 5 minutes to look for a resource. So what we did was we put a call center together to support the needs of our colleagues. And this is for all employees, families at HHC. So the needs of the workforce largely were needs for housing, safe housing if they felt that they were not able to return home after a busy shift in the hospital, or perhaps they'd been redeployed far away from home. Another need was childcare, given the disruption that we know that has occurred in that area in the country as well as locally. Access to food. We had set up groceries in our acute care settings. We wanted to make sure that they knew that that was there and what kinds of foods that they could pick up before or after work. In addition to that, we know that everyone is concerned about their finances given this uncertain time. And we wanted to be able to have access for them to reach out to identify ways in which they could get some financial support. The worries that people had were certainly emotional during this period of time, spiritual, as well as grief. There's a tremendous amount of grieving going on both in people's personal lives as well as with what's going on in our acute care settings in particular. We wanted there to be a one-stop shop for people to reach out and get that type of support. The call center was launched by training a group of redeployed staff who had volunteered for this work, and so their heart was really in it. And then following that, every single day we have a debrief on the types of calls that come in. And interestingly, we did tell people, just call for any reason at all. So we do have a miscellaneous column, so to speak, and people are calling for things such as, how do I access this aspect of their workforce, for example, if they've been redeployed. Masks, PPE, questions like that, and we're able to handle them immediately. So this center has had increased weekly call volume, almost doubling week over week. And I would say now that we've identified some of the core needs, we've reached out with marketing materials and communication materials that have been brought locally to the leadership and to the management to help to support the workforce at the local level, as well as at our community network, our rehab sites, anywhere where we're caring for patients. So I'm very proud of this work, and it's only just beginning. We expect we'll be needing this for some time to come. Thank you, Dr. Kumar.
Thank you, Dr. Kiely. I'm going to open for any questions at this time. Dr. Kiely is going to be with us as well, so you can ask questions to her or me, or we'll try to answer as best we can.
Dr. Kumar, this is Emily from The Current. I wanted to ask you more about the contact tracing efforts that you talked about. How many employees you have who are working on contact tracing, and can you give me the scenario in which a contact tracing investigation would be triggered? Is it for every person who tests positive, or just in certain cases?
Thank you. So we have, I wouldn't be able to tell you exact number of how many people we have because we've trained so many of them every week now. I think in excess of about 70 people, I guess, across the system who are trained at this time. But the actual number may be more than that. The way the contact tracing works in the hospital setting is that if we find a place where one of our colleagues turns out to be positive for whatever the reason, we want to make sure we track back the time period, last 24 to 48 hours, of all the contact anybody who've had, depending on the symptoms when it began, and identify those individuals and screen them for symptoms, and if needed, put them in the quarantine to prevent the spread of that. Now, that's a standard practice. Let me begin with that. It's a standard practice in the hospitals. We've had it for a long time. This is how we respond to any kind of outbreaks or any kind of things happening. But given the enormity of the situation right now we have with the pandemic, given the sustainment we're going to have this over the time, we are looking at it differently at this time. We're looking into training a large number of individuals across the system, because our focus needs to be you identify early, you contain early, you mitigate early. And that's all into creating a safety standard which is unique to us in the sense that we can respond 24/7 and prevent the spread. You know, Hartford Healthcare also created its own safety checklist right now. Our safety checklist goes through a lot of details about how individual clinical areas needs to function in terms of the social distancing, how the chairs needs to be placed in the waiting room, how the scheduling needs to happen for the patients, infection prevention techniques, how we can audit that happening across the system, who's going to be trained, how the champion is going to be creating. So a variety of work needs to be has been done already with our lead here to make sure that we remain as safe as we can be. As you know, Emily, this pandemic and this, unfortunately, the COVID patients, we're going to see that for a long time. It's not going to go to zero in the hospital, so we have to prepare for long marathon at this time.
And so the contact tracing investigations are mostly after a staff member tests positive, is that correct? That's
right, actually. And we do actually look into if the patients who have come in, generally now because of all the process we put together, any patient who comes in who has a suspicion of COVID is already placed in an area which is contained and all the PPE precautions are taken. So we don't see much spread happening or any spread happening from that exposure. We're also now adding a new, different way of testing everybody who gets admitted in the hospital. So another layer of security to a certain extent. So we want to make sure that we contain the spread. If patient comes in, there are two types of spread we can have in the hospital. If patient brings it, or the family or patient brings it. A family or colleague brings it. So when the patient comes in, we are already containing it. We want to make sure we take all the precautions. The visitor comes in, we are already screening them. We're making sure that they've been screened and appropriately triaged as well. If the colleague has it, then we want to make sure we respond by the contact tracing, screening at the doorstep, temperature screening, and the symptom screening. And if still we miss something, then the contact tracing begins.
Thank you.
You're welcome.
Good morning, Dr. Kumar. It's Bridget from the Republican American.
Hi, Bridget.
Hi, good morning. The numbers, as you say, have remained steady, not declining precipitously, and 307 is in keeping with that. And as you do mention, there are ups and downs, and it seems to be the statewide figure is doing just that, but not increasing a lot. Can you take a position on the state's push to at least reopen partially regarding social distancing and what that will do to the numbers for acute care?
So let me clarify. The Hartford Healthcare numbers have been declining. We are 307 today. We were about 314 yesterday. So we've been seeing a decline in Hartford Healthcare acute admissions. But some other hospitals across the state, Connecticut, may have not enjoyed the same amount of decline. But at least we have seen a decline, at least on the Hartford Healthcare facility, in the total number. Now, the social distancing, which governor's office is proposing, which is still the reopening Connecticut discussion, I believe, is still ongoing, and I don't think we have a final position on that part here. The way I think about it is that we need to have a widespread testing. With testing, we need to isolate individuals actually who are found to be positive. We need to have a contact tracing across the state, so that what we are doing in Hartford Healthcare setting needs to be done in the community setting, so we can identify, isolate early on, and mitigate the risk of spread. Now, if you do all of that and we start easing out part of the economy with appropriate measure of social distancing, and again, a lot of education about the hand hygiene and other things as well, I think we might be in a position to gradually open. I do want to put a caution into that. Early reopening or our not paying attention to social distancing is a significant risk for our community to continue to see a significant number of active cases as we go forward in the summer. And the resurgence in the fall or in the winter time would be a significant concern. So all these elements I just talked about are with very significant amount of caution. But if we did the testing, contact tracing, isolation, and we want to make sure that the hospitals are ready to maintain their capacity to respond if a patient requires the help, I think we should be able to weather the storm at this time.
Okay, thank you. So there is a possibility, though, that we could undo some of the good that has been done by effective social distancing, right?
Without a doubt. That's a significant concern, at least the medical community has right now. As you know, our social distancing has, quite frankly, it's not been a complete lockdown. We still have a fair amount of traffic and fair amount of accessibility on many of the things. We can see that throughout this lockdown as well. Yes, we have stopped the school and banned the travel, but still the community, I'm not entirely sure, has universally adopted to the measures as we were hoping to. And some states in our country have done a better job than others. I like to believe Connecticut has done a good job in that part here. But we are interdependent. We are still living on the same land. The transmissibility is easy to happen. And at the same time, as we go forward, we ease these restrictions early on, that we can create a significant challenge for us and a continuous spread. Look, the way I see what is going to happen, at least for the hospital census, we're going to see a lingering COVID patient. These numbers are not going to go down to zero, what I'm describing to you, in any hospital real soon. They're going to continue throughout the summer. That's an unfortunate place to be. In many sense, because if you look into some of the countries, they've been able to really bring down the numbers really rapidly. There is a significant decline on the cases. We are not going to be able to see that. We've done some work in the social distancing, which has been good. We were late in testing. Contact tracing has happened sporadically. So what we did in the last 3 months, we're not in a great position to make sure we bring these numbers down to zero or really contain the spread significantly. We are going to see that, and we have to figure this out, how we're going to live with the COVID and non-COVID world together.
Thank you. And just one more question. As more people recover from COVID, do we know any more about immunity? In other words, this term herd immunity. Will those people who have been exposed and are either asymptomatic or recover be able to suffer another occurrence?
So this is a significant debate in the scientific community right now. What does the immunity look like for patients who will recover? There are a couple of factors which I want to put on the table. The virus mutates. That's a natural habit of the virus. It mutates, and several times it could be. It's already mutated a couple of times, as we know. So we're still learning about this virus. It's so novel, so new that we're still learning about it. We don't exactly know the new variety or the new mutation of the virus, what it brings, what pathogenesis it has, the transmissibility it has. So that creates a significant concern for us to prepare adequately on that part here. because still new. Now, the immunity which we're talking about, if all of us, hypothetically, let's say all 3.5 million of Connecticut residents are infected and have recovered, that's more than 70% of them at least recovered, that would create a possible immunity among all of us at that time. So hopefully, the next infection which occurs, if it is with the same virus strain or the milder one, we would be more protected to fight that off. And that's what the concept of the herd immunity comes along with that. But we're not quite there yet. We're not quite there yet because we don't know a lot of things. We don't know how many people are already infected because we haven't tested enough. That's one. The second, the virus, as you look at the numbers, active cases are still actually going up. The number of cases are still going up. So we're not quite there yet. I do not, and we don't understand the immunity what brings at the moment. Is it the right type of immunity? Is it really neutralizing the virus completely? The studies are still out there, and we don't have a conclusive evidence of that. So all those conversation needs to be put in place, that we need to exercise significant amount of caution as we deal with this pandemic. In this phase, which I call it a plateau phase at the moment, not an entire recovery, but a plateau phase. So we need to be very cautious about this at this time.
Thank you.
You're welcome.
Hi, this is Gabby Molina with Fox 61 News. I was wondering if you'd heard about the New York Health Department said that some children that had tested positive for COVID-19 were also showing symptoms of either Kawasaki disease or a toxic shock syndrome. Have you heard about that at all, and are you looking into it?
We're keeping an eye on that. That's on our radar. We, as a Hartford Healthcare, as you know, do not have significant children population, so our CCMC colleagues are, I'm sure, are paying attention and on top of it. I'm not aware of any case like that in Connecticut at the moment, but that's a significant concern. Essentially, what we're finding in these individuals, and I think it's still, we need a conclusive evidence of that, but we're finding this individual have some sort of arterial disease, which is which can affect their functioning of the heart, and or have a toxic shock syndrome. This virus is presenting in a very strange way. We've seen some significant signs in the skin disease coming up. There are post COVID-19 related after effect on the lungs for the individual. So we're still learning about this COVID-19. This is something we've never seen before. So we will have a lot more learning at this time as we go forward.
And can you just quickly describe what exactly Kawasaki disease is and what toxic shock syndrome would look like?
Look, I want to make sure that I don't create a panic among the community who's listening about that, because it's still early stages of information. The disease is the medium arteries gets affected. There's inflammation. Medium-sized arteries gets affected. There's inflammation and can lead to difficulty with the heart function, or the vessels actually don't work all that well, which creates a problem. The toxic shock syndrome is a rapid shock-like state. It's like what we described it before, is that the patient actually gets infected. There's a significant response from the body's immune system to contain that. And it's almost the body gets in the hyperdrive to contain the virus, and sometimes can hurt itself rather than benefiting with that response. That's essentially the toxic shock syndrome. It's a rapid multi-organ failure, which happens because the body's response is so furious at the time.
Thank you.
You're welcome.
Dr. Kumar,
this is
I just wanted to ask about the modeling. It only takes us through mid-June. Is it currently being worked on, or are there plans to extend the MIT Hartford Healthcare modeling? And also, do you still see us on track for the 7,000 deaths predicted in the model currently in Connecticut, ?
Yeah, modeling has been worked on to expand all the way till August at this time. I really hesitate to put numbers on the mortality, but let's talk about the ranges. That's where we should be. I think the range is going to be somewhere between 3,500 to 7,000. That's the range we're looking into. I hate to say this way, but we could exceed 4,000 by early June at this time, with the speed we are going right now. So modeling will help us, but modeling allows us to prepare, and I hope we prepare better and we take all the precautions. We take the social distancing methods seriously, and as we go forward, we think about how we're going to be paying attention to wearing the mask in public spaces, making sure we respect each other's social distancing or physical distancing. etiquettes. So we need to continue to learn with that.
Dr. Kumar, this is Emily from The Current. I wanted to follow up on a couple of my questions about testing capacity yesterday. Can you tell me a little bit about what you think the limiting factor for your sample collection capacity is right now?
We have eliminated most of those limitations with our partnership with Quest to get to 2,500 site. It's access to the patients, or patients being able to access the testing sites. That's a significant capacity. We're still talking about a lot of underserved area. We're talking about the folks actually who do not have means to travel, do not have somebody to drive them to the testing area. So what Hartford Healthcare is trying to do is get to those places, get to the places where the people cannot travel, and that takes some time to organize and make that happen. Nursing homes, one good example. As you know, Hartford Healthcare Nursing Homes, we created a process that we are taking our individuals to collect the samples in all the nursing homes, which are Hartford Healthcare, to be able to collect that. Now, that's not always possible in all the nursing homes across the state of Connecticut. So bottlenecks are access to the test right now, not so much about the kit and other things, which is loosened up quite a bit, which I used to talk about the VTMs being the shortage, the swab being shortage. We have more capacity now. That's a good place to be. But the access to the test is still a challenge.
Thank you.
You're welcome. Tina, any other questions?
We have one question on Facebook. Is Hartford Healthcare going to be testing all employees?
Is Hartford Healthcare is going to be testing all employees? We are testing employees who are symptomatic at this time, and we are looking at the research study to do the antibody testing. We're going to start with 5,000 individuals by Friday, and hopefully we expand it to all the 30,000 colleagues soon. And antibody testing will allow us to at least understand how many individuals may have been at least infected in past. Regarding doing a PCR testing, we are in serious discussion right now to initiate the process to test everybody. There's a lot of complexity with that process, and we're looking into how to roll that out. We have not made a final decision on that, but we are discussing about this.
Another question, how many more positives are hospital discharged sent home for quarantine?
How many positives are sent home for quarantine? I actually don't know the number. I'm sorry. That's a great question. I do have the number somewhere in my data sheets, but I don't have it right in hand in front of me. Thank you.
And then how many patients at St. Vincent's Hospital?
St. Vincent has 80 patients, 80 at this time. Very good, Tina. There's a lot of questions. Thank you very much. I appreciate everybody's time. I hope everybody writes about the wonderful nurses. I keep reminding you what to write, and please do write about the nurses. They're doing an amazing job throughout the state, throughout the country, especially in Hartford Healthcare. Thank you.